name is Ted Jagger, and I'm a paramedic here at Perry County Ambulance. And today we're going to go over the skill of bleeding control and shock management at the EMT level. The scenario, you're dispatched to a 31-year-old male patient that was involved in an industrial accident, has a laceration of the right leg. We're going to get started. As always, BSI. And we'll make sure that our scene is safe. So I'm going to put on my gloves and make sure that our scene is safe and all the industrial equipment is either shut off or removed from danger, and then we're going to get started on our assessment. So our patient has a laceration of the right leg, so the first thing that we want to do is control it using direct pressure. So I'm going to use both my hands. I can also use a bystander or somebody else that has appropriate PPE on in order to control direct pressure. And I want to push down as hard as I can to try to stem that bleeding, and you want to push down for 3 to 5 minutes on the affected area. So moving through the scenario, we have determined that that did not stop the bleeding. So what we want to do now is we want to grab our tourniquet and apply our tourniquet. So our tourniquet is just going to be a CAT tourniquet, which stands for Combat Application Tourniquet. It comes in this form. It's a nylon strap, plastic windlass, a time tab. And we're going to open that up and place it high and tight on the patient. So we want to go above the wound, making sure that we're not over any joint. So in this case, it would be the knee joint because the patient has a laceration on the right leg. Once we get the tourniquet around the leg, we want to pull all of the slack out as much as possible. Once we have all the slack out, we want to take the windlass, which is this plastic bar right here, and turn it until the bleeding stops. And then we put the time tab over the tourniquet, write the time down, make sure you mark the time so that the ER or any surgeon knows what we're doing, and when we place the tourniquet. Another thing we want to do to check the tourniquet effectiveness is we want to check for pulses. So down here, we're going to remove the shoes or the boots or whatever the patient has on, and we're going to check for a pulse. An effective tourniquet, you will not have a pulse. So we don't have a pulse, so the tourniquet is good. We've assessed it to make sure that we've stopped the bleeding. And then we want to properly position the patient, so we're going to position them for transport. We're also going to want to start administering high flow O2. So we have our oxygen tank here. We have a non-rebreather mask, which is going to be our oxygen delivery system. So we're going to hook everything up, put it at 15 liters a minute, place it over the patient. Lastly, what we want to do to prevent shock is we want to cover up the patient and keep them warm. So we want to prevent any hypothermia. So I'm going to take this blanket here, but you could use any blanket that you have. You could use the heat inside the ambulance, any method to keep them from getting cold. And due to the nature of the injury, we want to get them to the hospital as quick as possible. So we're going to identify them as immediate evacuation. So we're going to get them in the ambulance as soon as possible, and we will get on our way.